makes me proud is I interact with patients on a daily basis, and just the positive responses that I get from them as far as their nursing care, the doctors, interaction, it just all comes together. It makes me feel proud.
I'm proud to work at Levendale. We have a stellar reputation in the community. We deliver the utmost professional care to all of our patients and residents, and we thrive on clinical excellence.
I like working here at LifeBridge Health because of the type of healthcare that we provide in the community, its diversity, its professional advancement, and being a part of a team that's responsible for the new infrastructure of this facility.
LifeBridge actually gave me a second chance at my life and my career. I worked for LifeBridge once before as a young teen, and I was on a no-hire list. And I came back and applied again and explained myself and explained what's going on. And they actually gave me a second chance, so now I have the chance to care for my residents and show the type of person that I really am as I grew. And LifeBridge is a really great place.
LifeBridge as an organization, as an institution, has really evolved in a way that positions it perfectly to meet the challenges of the new healthcare system that we're trying to design. And the reason for that is because it really covers all different parts of the spectrum. You look at LifeBridge, obviously you've got acute care covered in there and covered in a very efficient and high quality way. You've got home care, you've got primary care, you've got a connection to teaching the next generation of caregivers and physicians. And so that broad perspective that LifeBridge has acquired over many, many years of being involved at all levels of healthcare and working with all of the different professionals out there that can make the system function in a high quality way, that really positions LifeBridge beautifully for the opportunities that are going to be presented by the healthcare reform that we've been putting in place.
I'd like to thank the LifeBridge community for the various initiatives that you have in improving public health and public safety throughout the state of Maryland, particularly the DOVE program at Northwest and the Family Violence program at Sinai. Governor Martin O'Malley and I have established a goal to reduce violence against women and children. We believe that there's no place for domestic violence in Maryland, either in the home or in the workplace or anywhere else. And in order to achieve that goal, it's important for us to partner with hospitals and nonprofit organizations throughout Maryland. And we've been really excited in being able to do that with LifeBridge.
The centerpiece for any community is really the healthy environment in which it's created within. And LifeBridge Health really does own, live, and breathe in its communities. And we're excited in Baltimore County that we have Northwest Hospital that really is a partner with us in our schools. And not only are they participating in several schools right now, we have future partnerships, particularly around health and science careers.
LifeBridge Health has had tremendous growth over the last 15 years. Under the Affordable Care Act, or health care reform, there's so much uncertainty. With that uncertainty, LifeBridge is poised to take on the challenges and opportunities. There's going to be tremendous growth with the Medicaid expansion, with new enrollees getting services through the Health Benefit Exchange. LifeBridge has the integrated delivery system and the human capital that can take on those challenges.
LifeBridge's contribution and support of the Park Heights community is vital. As one of the major funders for Park Heights Renaissance, it allows us to develop and implement programs that support the human services component of our organization.
Sinai isn't an organization that cares for the community. It's an organization that's involved in the community. We have a terrific relationship and a partnership with Sinai Hospital. Sinai not only is a caregiver for people in the community, it is also an employer of people in the community. Sinai serves as an anchor. It serves as a way to bridge and to enhance the community.
Well, we're all about the future. We're all about change. We're all about new things happening. I know there's a lot of new things happening here at Sinai, and I feel like we have to go with the change and feel and see what it's going to be all about.
I've worked at various facilities within LifeBridge Health, and change isn't always easy. But here at LifeBridge Health and at Northwest Hospital, we're used to change, and that flexibility really allows us to create a stronger healthcare system.
I think that LifeBridge and Sinai have a very bright future. Neil Meltzer is certainly very good about combining the best that we have to offer at Sinai as well as at Northwest, and I think that Amy Perry has a great vision to improve the strength and the efficiency in the operating room. It's very user-friendly. It's a friendly place to work. It's how I like to practice, and I think it's a great place for patients to be and doctors to work.
I'm excited about the future of Northwest Hospital because I think there's great growth potential for our general surgeons, both laparoscopically and in the general surgery field.
I'm excited about the future here at Northwest Hospital because of the Women's Wellness Center. I think focusing on wellness instead of illness is a great asset for the community and something that is very unique to Northwest.
I'm excited about Northwest Hospital because we're finally turning into a hospital for women. I think having that touch of physicians who can feel for their patients by being in their position takes us from being just compassionate caregivers to champions of care.
As far as the future of LifeBridge is concerned, I am very, very excited. I think timing is everything, and there's a confluence of a number of positive things that are happening that I think will make all the difference in the world. One of which is very obvious, is the Affordable Care Act, which is coming on and affecting all of healthcare. And it's a challenge for all of us because there's still so many questions about how it will go and where it will go and how we will address it. But more importantly, we have the comfort of knowing what we've done over the decades with all of the LifeBridge system in providing the appropriate services and care for people in need. So that confluence makes it a great time to come in as chairman and to work with the LifeBridge system.
I think sky's the limit as far as the future.